The pandemic created a more sedentary and sometimes isolating lifestyle for us all, leading to increased alcohol consumption and even opioid misuse. Liver Program Director at UCSF Fresno, Dr. Marina Roytman, explains why liver disease and other comorbidities are on the rise after the pandemic and the correlations between COVID-19 and the liver. Societal disruptions brought on by the COVID-19 pandemic have made an impact on our health in many ways.
And some of those societal disruptions led to the increase of alcohol misuse that certainly predisposes you to increase in liver disease. The other things that happened is we've become more sedentary. Our dietary habits have changed, and a lot of us have gained weight. That predisposes you to developing liver disease. The increase in viral hepatitis. The pandemic again exacerbated the opioid epidemic that's been already ongoing. So more patients are using illegal drugs, more patients are getting infected with chronic hepatitis C.
UCSF Fresno performed a study to compare health outcomes of patients with liver disease who did and did not get the COVID-19 vaccine.
And what we found out in our study, that patients who do get the vaccine do so much better compared to the patients who do not get the vaccination. And interestingly, the group of the patients that got the COVID vaccine, the ones that did better, were older and had more diseases, or what we call comorbidities, compared to the unvaccinated group, that they were younger and less sick.
Dr. Roytman says COVID-19 by itself does not cause long-term detrimental effects to the liver.
Many aspects of metabolic syndrome and fatty liver disease and diabetes and high cholesterol, do tend to get more sick if they catch COVID-19. However, we do know, as our study showed, that vaccinating those type of patients will wipe out this increased risk for getting more sick.
And if you find yourself using substances more and moving less, Dr. Roytman wants you to know that there is hope to start again.
The greatest thing about the liver is it's the only organ in the body that can regenerate or rebuild itself if we give it a chance, right? So even patients who have had significant liver damage from increased alcohol consumption during the pandemic, when they stop drinking entirely, the liver has the capacity to heal itself. The other thing that I encourage my patients to consider is attending AA, or Alcoholics Anonymous, right? This is a really amazing support system for patients who want to stop alcohol consumption and stay sober.